from Pittsburgh. I'm a psychiatrist, and I'm the current Vice President of AAPI, American Association of Physicians of Indian Origin. I want to thank you for being here with us, and so we can spread our message and all the work we are doing on behalf of AAPI, which is one of the premier professional organization, second only to American Medical Association, representing about 100,000 Indian origin physicians. And we're a very active organization. We have usually annual conventions, which is actually scheduled in a couple of months here in Atlanta. Please join there also. And meanwhile, we are hit by this COVID crisis that is surging again in India. So our leadership took a quick action to reach out to all our members and seek their support. And I'm very gratified to report to you, our members rose to the occasion. They have contributed enormously and generously, quickly, without even us making a phone call, just on their own. So we already reached 2.2 million donations, but we are targeting for higher donations as well. Not because just they are able to do it, but because the need is there. So far what we have done, like Dr. Sudhakar, my good friend, President of AAPI said, we have procured at least 1,000 oxygen concentrators and shipped them through our partner SEWA, because they have a good track record of working here as well as back in India. They're able to go to the manufacturing facility in Alabama and got them quickly manufactured to the specs that required in India, and we shipped them very quickly, and yes, Dr. Sudhakar sent it off on Friday morning. So it should be reaching there in India by now, and they will be distributed as needed basis where it is critically needed. So we are very confident it will reach to the right people at the right time, because that's the way we can save lives. And then we still have some reserves, we still have some plans to do more. Because the crisis is going to unfold more and more, there will be more hospitalizations, more technical help they will be needing for managing these critically ill patients, and the ventilators will be required. Even masks will be required, because everybody has to wear masks, and all these cloth masks are not going to be effective. So all the protective equipment needs to be there. So we're going to meet, like Dr. Sudhakar alluded to, the Health Minister of India, Dr. Harsha Vardhan, a good friend of AAPI. We're going to have a Zoom meeting on Monday at 12:30 Eastern Time. So we're going to introduce ourselves again. He has been to our conventions and our meetings all over, both here and India. So we're going to reintroduce him to our programs and our plans and seek his support and guidance, because they know what they need and what they want, what are the restrictions and constraints they are operating under. So we're trying to make them relax any bureaucratic and technical regulation they might curb our participation. So we're going to seek some kind of immunity for physicians from here to consult with them. So that's very critical, because doctors in India are feeling the burnout. They're fatigued. I get calls from the doctors showing so much anguish in their tone of voice. They're seeing people dying right in front of their hospitals. They're crying. The families are wailing and crying so tragically. So they're feeling so helpless, so anguished. I became a doctor to save lives. I'm not even saving lives. People are dying for just lack of oxygen. This is a very tragic situation. We can save so many lives if we can get the basic care and basic education to the masses. So actually we are reaching out to many Indian physicians through our Zoom meetings every night, and we are talking to the doctors and patients directly and advising them how to protect themselves, how to seek help, how to monitor their symptoms, when to seek help, where to seek help. So we're doing all that already, but we want to do it at a bigger scale, at a national level, because thousands of American Indian doctors are ready to jump into the fray. But they just want some clearance that they can do it without any hindrance. So if we can get that assurance from the government, we'll really make a big impact. The doctors are really fatigued back there, and we're going to support them, because we know how we went through here when we hit the crisis in New York and California and Atlanta, everywhere, how doctors were burned out. So they need all the support, and many doctors are coming forward here. And young, even the first generation doctors who have never been to India, don't speak Indian language, are still ready to do whatever they can. I think we need to connect our expertise and their needs and match them. And then next thing is ventilators. They're also very critically needed once the hospitalizations start increasing, and they'll be needing ventilators, and they're also in short supply. We're also, Dr. Sudhakar is working very hard behind the scenes to procure as many good ventilators, quality ventilators that are adaptable to Indian conditions. So we're working on that. So then we have some good partners and friends are providing free platforms for Indian doctors here to connect with the patients in India. So we have Dr. Sreeni Gangasani here. He will also explain a little bit about his platform, and he is offer a free access through his platform too. So we are using all our connections, all our abilities, all our kind of energy and compassion to reach out to the needed people. So we need your help to spread the message. And next thing we're doing is, like Sudhakar alluded to, we're going to Washington, D.C. on Wednesday. We're trying to meet the political leaders. We have good leadership in every city. In New York, we have good leaders. They're reaching out to Chuck Schumer through their connections. We have good leaders in Maryland. They're leading to Steny Hoyer, the Democratic leader in Congress. And there are leaders in California. They're trying to reach out to Kamala Harris through their connections. So we are using all our resources. AAPI doctors are a very powerful, well-connected, well-respected group. And we have such a network of physicians. We're trying to leverage their connectivity with all these politicians. If we can get to the right person, it will happen. The AstraZeneca vaccine that is in the warehouses here can be released to India quickly. They'll be saving millions of, not immediately, but in the long run, they'll save a lot of lives. So we want to promote the vaccination program. We want to promote the lockdown program. We want to promote good practices, not go to quacks and not do some crazy things to take care of themselves, but follow the guidelines. As far as conditions in this country, please listen to the CDC guidelines, not YouTube, not WhatsApp, not some quacks. Because this is a serious illness that requires serious thinking and serious engagement with the clinicians and professionals. Just follow the CDC guidelines. If they tell you to wear mask, just wear mask. Don't question everything. Because yes, questioning is good, but your questions have been analyzed already by the CDC. They have experts. Please listen to them. And please listen to your doctors. I also urge many medical professionals as well to take the vaccine. There is some hesitancy even here. And I hear it from my own colleagues and my own friends. And when I took the vaccine, I put the picture in the Facebook just to send the message. This is the right thing to do. This is evidence-based, science-based activity. We need to promote that. So that's another message we want to send out. The crisis is not over here either. So it can happen again. Like you all alluded to, the mutant virus is here. So we need to attack that as well. If you have any questions, feel free.
Okay, in India, millions of people are scared to take the vaccine. In fact, in the first dose also, people are scared to take it. Right. So any message for them?
Right. Like I said, please listen to the experts. Please listen to the professionals. They have the knowledge. They have the science. They can advise you very well. Right now, the vaccine is the best option. Anybody declining it is really not using their good judgment. Vaccine is the only thing that's going to save us in this crisis. More people get the vaccine, the better it is. Unless everybody is protected, nobody is protected. So we need to get everybody to be vaccinated. There are a variety of vaccine in India that are a little bit different from what we have here. The Pfizer and Moderna that are very popular and very effective here are not available, but they have their vaccines that are good. Covaxin, Covid Shield, and now Sputnik, they're all available now. So let's use them. They are expensive a little bit for the Indian conditions, but they are being offered freely. So take it. I know there is reluctance. Even doctors in India are kind of not using good sense sometimes. I think sometimes when you are in a crisis, people become fearful. Fear clouds your judgment. Think clearly, rationally, use your wisdom. Don't listen to nonsense from social media or some quacks, some non-medical, non-professional physicians, groups. So use your common sense and follow the good practices. That's simple.
Doctor,
yeah.
Thank you. That's a great message. And coming to the vaccinations, right? In India, May 1st, they have opened up 18 and above,
Yeah,
right?
Right.
So would you be discussing with Harsha Vardhan in your meeting about how the plan would be to get vaccinations so that the surge will be less? And second question would be, how about the ages under 18 years? So what is the impact if they don't have the vaccine? And do you have that plan?
It's a very, very good question. I'm not the expert on it, but I'll give my common sense explanation. Yeah, 18 and plus are being vaccinated beginning May 1st, which was today, I think, or yesterday. And So that's good, but the problem with right now, the vaccine is not available in India as well. Supply is low. Finally, Sputnik released 150,000, which is not even like a spit in the bucket. I mean, we need at least 100 million vaccine doses or more. But we have to start somewhere. It has to be a continuous process. It might take the whole year to vaccinate, and we have a small number of group of people are vaccinated. And India has magnanimously and humanely exported a lot of their vaccine to a lot of other countries. But now the need is in India, so they need to take care of Indians first. And it's not anything wrong to do it, because unlike when you're flying an airplane, what does it say? If the air pressure goes down, you first put the mask on first before you get put on the child. So we have to save ourselves and save our resources, and then we can help other people. So that is the key. As far as under 18, the science they haven't studied it, but there are some vaccines that are used under 16 here, up to 16. But luckily, that age group are relatively less prone to be critically ill, but they can have critical outcomes too. So even there, we have to be careful. The teachers need to be vaccinated. The schools have to be very carefully operated, and we need to spread the message: wear the mask, wash the hands, keep the distance, and all those simple things. Don't take anything for granted.
What do you think India could have done better to avoid this variant?
That's a 20/20 hindsight, Monday Night Football. But which is okay to ask, but nobody knows the answers, all the answers, until it happens. So I don't want to be kind of a Monday morning quarterback. But yeah, we always can do it better. Even now we can do better. Even now we can do better here. Even now we have people who have hesitancy to take vaccines. We need to educate them. There's no alternate but science and evidence-based and expert-provided treatments. Don't rely on any other pieces of nonsense.
Doctor, another question, important question. Most of our Indian citizens is certain population in India. So we get news that they are not given vaccination. So in your Washington, is there any way you can request that we can send some Pfizer or any other doses for them, which will be a plus?
Yeah, I'm not aware of it, but it's a very important question that you're asking. If it is happening, obviously American government will take care of it, because that is their number one priority, to protect US citizens wherever they are. For example, something bad happens to Indians anywhere, American government immediately takes care of the problem and sends whatever resources. Definitely the embassy will act on it. They can, like you said, they can export the vaccine immediately, and whatever is approved here, some of them are not approved in India, Pfizer and Moderna. They haven't put the request for approval. But since it is US citizens, maybe they'll be able to receive it right there. So those are the options. AstraZeneca might be approved here soon. That might be available there too. So that's a very good question. We can raise that question to Dr. Harsha Vardhan, the health minister, at our meeting.
Thank you. And you spoke about, I know that some of your colleagues will speak about that, but I just wanted to know the platforms, what you are enabling for the citizens of India if they can reach for any of their emergency.
Right. So first thing we want is to get the reassurance from the government that it is okay for us to do it. Without that reassurance, there will be a little bit of reluctance and hesitancy to offer. We are doing it humanitarian basis right now without asking any reassurance. But larger number of people will really participate in that kind of activity if we have much more clear guidance. Just like US kind of declared a kind of a global immunity to all physicians who are providing COVID care, there is some kind of legal protection here. So that makes us free. I mean, doctors are going from California to New York when the crisis happened, from everywhere, Michigan to New York, to serve the needed. They didn't need a state license. They didn't need insurance. They just went there and provided care. This is a war. You cannot ask for show your license, show your ID, those kind of things. Yes, you verify, but trust us. We are good people. We're willing to help you. And we have digital platforms. Our like India is blessed with IT and good IT technology, and Indians here are very good at IT. So we have all these things are converging. We have a lot of synergies. We need to kind of utilize all these platforms. I think if we can connect with doctor-to-doctor consultation, that'll be great. If we connect even more doctor to patients with a wider community, that'll be great. If we can reach out to not just urban population, but the small towns, rural areas, which will be critically needed, we can be really saving a lot of lives.
Thank you.
Are you going to suggest to Dr. Harsha Vardhan about stopping the religious events, election events kind of thing, because a lot of public gatherings, right, that is
Yeah.
spreading.
I mean, Harsha Vardhan, Dr. Harsha Vardhan is a very smart man. He's a very educated doctor. He knows, but he's also a good politician. He knows the cultural and political aspects of it. But I would also urge the religious leaders to be the messengers there. If they say this is not right, people will listen more than what politicians say. This is a religious issue. All the religious leaders have to come out and announce. You don't need to come to temple. You can do seva and puja from home, where we can offer you support. We can offer spiritual, religious support for your soul and your well-being through kind of digital way of connecting. You don't have to so the religious leaders also have to rise to the occasion and show they care about humanity. Like they say, Manav Seva is Madhav Seva. So if you serve humanity, you're serving the God. So take this opportunity to be real leaders of humanity, not just the religious leaders of your own small group.
Thank you.
Thank you. Next.
My good friend Satish Kathula is the Secretary-elect of AAPI, and he will be speaking next.
Hi, hello everybody. My name is Satish Kathula. I'm a hematologist oncologist from Dayton, Ohio. I'm the Secretary-elect and the current treasurer of AAPI. And it's a very, very sad situation in India, as we all know. And AAPI is trying to help in many ways, as the other leaders alluded. And we procured at least 1,000 oxygen concentrators, which have been shipped to India a few days ago. And we procured another 500, which will be going soon. And we appreciate all AAPI members' contributions. And also non-AAPI members are trusting AAPI nowadays and donating even without asking. They are volunteering to donate their money, their time, trusting us. So that is a big thing which did not happen that much in AAPI before. So we are proud of that. And the credit goes to the current leadership. And we thank all the donors, all the people who are actually coming forward to help us in many ways. And there is so much need, as we all know. Not only oxygen concentrators, pulse oximeters, and we need ventilators, we need other oxygen delivery devices like CPAP and BiPAP, things like that. These are all the things that we are trying to raise money for. Whatever we do is a drop in the ocean, but without drops there is no ocean. So we are trying to do something from here, whatever we can. That's from one front. From the other front, we are trying to provide medical services as much as possible, educating doctors through Zoom meetings. And we do have 3 telehealth platforms which can actually enable us to communicate directly with the patients. But again, there are liability and licensing issues. We are working on them with the Indian government and Indian Health Ministry. Actually, as others mentioned, we do have a meeting coming up tomorrow, and we can discuss that point as well, so that we have more physicians treating patients in India. So, we get all these phone calls, asking for help, but sometimes we feel helpless. If India doesn't help us, we cannot help. It is as simple as that. We do have manpower here. We can at least tackle some issues. We cannot fix everything there, but we can treat some patients in cities or urban or rural areas from here. If they remove the liability issues and the licensing issues. And we also appreciate all the doctors who are coming forward to participate in this from India too. And we want more people from India to reach out to us. If they need any help, please ask us. Anything medically challenging, some cases that they are not comfortable dealing with, they can ask some advice, and we are willing to do that from here. And on legislative level, we are actually going to Washington DC next week, as other leaders mentioned, to actually ask them to send the vaccines to India, which will make a huge impact. It may not be immediate, but in future there will be more waves coming, more variants will be there. So if we can prevent it that'd be a great thing. Also, we are writing a letter, we actually did once already to Prime Minister's office to lock down the whole country, which is very, very important in this situation. Containing the virus. Containing the virus is utmost important at this point. And also the vaccinations as much as they can do. And the Sputnik vaccine, they got a few doses, but if we can send some, I urge US government, the White House, the congressmen, senators, and everybody. And if you have a representative who you know, please call their office and to ask them to put some pressure on White House to actually send these vaccines and help India in a big way. It's a country of 1.3 billion people. We need a lot of help from here, from Indian government, from everywhere, from all over the world. We need help to save lives. We are losing lives every second, and you have seen on TVs how horrible the situation is. So there is urgency to this, and it's not only doing this, but we have to do things fast. We have to act fast to help these poor patients. In cities, patients don't have ventilators, they're dying in front of the hospitals. We hear these horror stories through media and through friends, relatives, every day. And we get a lot of phone calls, my friend is dying, my family member is dying, can you get me an oxygen concentrator? So all these things. I think containing is very, very important to not to get into that situation. And another message I want to give is, even if you get a vaccine, even if you're vaccinated, be careful. Think that you are not vaccinated. Still wear your masks. Still you need to do the physical distancing. You have to wash your hands, use sanitizers, and do not travel or do not go to parties or conduct all these rallies. This is a big thing that has happened recently, and that's what we are seeing the results of. It's all science. There is no, we expected this anywhere. It's not just, I'm not pointing fingers at anybody, but we got to control this with all these measures. Even if you're vaccinated, it's a good idea to practice all these things. And that's the most important thing, in a short term. But long term, yes, vaccines are very, very important. And that's the message I want to give. Thank you.
So people are scared to take the virus, as I said, people are, I'm suffering with cancer, I'm already heart disease kind of thing. So you want to suggest anything for them? Because they said, we are already ill, the virus, the vaccine will inject, some virus in me.
No, there is a misconception. There is no live virus involved here. It is all, actually not even a virus. Especially some vaccines have what is called mRNA technology. And the mRNA actually, these vaccines produce spike protein antibodies which actually attack the virus. So they're not going to get the virus when they get this vaccine. So basically it increases their immunity. But these are the people who are actually prone to get infection more than others. If you have comorbidities, for example, diabetes, heart disease, cancer, all of these can actually increase the risk tremendously. And if somebody has to get a vaccine, those are the patients who have to get it. So there is a myth that these are causing, there is a little truth to that, but we always have to look at the benefits and risks, the benefit-risk ratio. The benefits are tremendous of getting the vaccine, not only preventing this wave, but preventing future waves too. And the price you pay is very little in terms of side effects. You may have little body aches here and there, some headaches, but we all got it. We all got it, and we are still here. So it is, completely a misconception. People have to come forward and take it. That is the only way to prevent this pandemic.
Thank you.
Thank you.
Dr. Satish, we just wanted to know about this vaccination and what is the next booster. People are saying next 6 months again we have to take a booster. So do we have any intelligence on those areas?
No, we don't, not yet. They are saying the immunity with the vaccines will work for at least 6 months.
Mm-hmm.
So we are not even into 6 months yet. Whether this will, they are still following the patients in the trials. So we will know soon. Every few months they'll be updating how long the immunity is going to last. If it lasts for years, that's great. But if not, if we have to take a booster shot, so be it. So we are ready to do that because we take flu injection every year. And also, I want to urge the government, once the FDA approves this completely, to make it a mandatory thing to everybody. We actually make a flu vaccine, in hospitals to get, so that people won't get sick, they won't really spread the infection. Why not for COVID, which is 10 times deadlier? So I think there should be a mechanism of really making this a mandatory thing so that everybody is vaccinated. So that is the only thing. The science is saying that, the trials are saying that, scientists, doctors, everybody is saying the same thing. And people have to understand, we don't want to cause any harm to people. We only tell whatever benefits them. So, we ourselves took it, and if we have to take more, yes, we are ready to do that.
On a lighter note, apparently state of West Virginia announced they're going to give a $100 bond for everybody who got a vaccine. So they're incentivizing vaccination. The private companies are doing it. They're giving some extra money or benefit. So we need to incentivize it and make it more acceptable, popular, and readily taken. So these are all the things we can do as a government, as a private agency, as doctors, or as the media to educate the value and the benefit of it.
So on these grounds, do you think in future, I know we don't have an answer for that, but I wanted to ask, do you think the flu and COVID is going to combine in future as a vaccination?
Well, there is a possibility, but still we are very early. So to get one vaccine and get rid of everything would be great. But whether this is going to work or not, we don't know yet. But that's a possibility if there are trials, if they prove that getting one injection can cover a lot of, that's definitely convenient, but we don't know that yet.
Awesome. Doctor, do you know in our AAPI members, any of the members are involved in any of the researchers?
Well, definitely. Across the country we have 100,000 doctors, and there are so many hundreds and thousands of doctors who are actually doing COVID research who are of Indian origin, yes.
Awesome.
We are involved in administration, we are involved in research, a lot of scientists, a lot of doctors in academic institutions, and they are doing their job, yes. We are proud of that.
Thank you.
Hi everyone.